Okay, let's talk a little bit about the modifiers. These are on this front, the cheat is this front page of your, or the front cover of your CPT. Also in your Appendix A is the explanation, let me pull that up, is the explanation of all of them. Now this is covered, or these modifiers are covered in your Chapter 8, which the basic CPT was Chapter 8 as well. But I just wanted to go over a few of these in a very short video, and then I'll get a new video going into our E&Ns. So remember, this is your explanation of them here in the Appendix A. In your textbook on page 333 is a table, Table 8.1, that goes over, here, let me pull that into here, maybe that'll help, which goes over, we don't really need our CPT right now for this, but this table goes over, this is a really, really good table that kind of tells you when you use them for E&M, if they're E&M only, or if you can append them to procedure codes, because there are some that you can and some that you can't. And this is a really good, just page after page explanation of all of them. I really encourage you to sit and study this, but let's talk about just a few of the modifiers that kind of will give us some trouble, and I hope I don't start coughing. Better get it. Okay, so on page 333, and please take notes, any notes that you put in your textbook, you may want to transfer into your CPT manual as well. So the first one to talk about is modifier 25. And this is only put on E&M codes. This is when perhaps the scenario is you have a procedure and an office visit. Maybe the procedure, the office visit covered an upper respiratory infection, and the procedure covered maybe like a incision and drainage of a sebaceous cyst or of a boil or something like that. So you would put a 25 modifier on the E&M code so that it would get paid along with a procedure or another E&M. Maybe the patient showed up for a preventive visit and then said, oh, by the way, I've had this cough for a week. So then you would have your preventive visit E&M, and then you would have a office visit E&M level that you would put a 25 modifier on. 25 modifiers only go on E&M codes. You will never see them on procedure codes. And this table is excellent, showing when you can use them and when you can't. Make sure you take heed to this last column because these are a hospital outpatient only. Okay, the next modifier is 26. This is a professional component. These are only put on radiology codes. So when we get into radiology, almost every code we use will have this 26 modifier unless the code description includes the interpretation or the professional component. The 26 modifier signifies the physician side of the x-ray and does not reimburse for the technical side. Example, patient needs to go to the hospital to get a chest x-ray. The hospital owns the x-ray equipment. They pay the staff or the radiology techs to take the pictures. So that is the technical side. But then there's a radiologist or a physician who reads the x-ray. That's the professional side. And remember, we code for this class for the physician only. So this 26 modifier kind of cuts that x-ray into bits, and this is the professional part of an x-ray. We'll see lots of examples of these. Like I said, I'm not pulling out all of these, I'm just pulling out a few. 30 51 modifier, multiple procedures. So a patient comes in and has a laceration on the hand and has a laceration on the face. Those are two, they're the same, different diagnosis codes, but same type of problem. So you would code the laceration that was the most involved or the biggest or the most complex first. And then the second laceration, say the hand laceration was 4 centimeters and the face laceration was 1 centimeter. Both of them close the same way. You would code this 4 centimeter first, no modifier. Then your second procedure, you would put a 51 modifier on because it is multiple, the patients in the 1 OR, the 1 draping, the 1 sterile technique, you know. So it's multiple procedures at the same time, pretty much doing the same type of procedure. Whereas your modifier 59, distinct procedural service. Say the patient has a, I'm trying to think of a simple, because we have oh, there. Now I'm back. Yay. It froze for a second. 59 modifier simply notates that something distinct procedure-wise has happened that is separate from either an E&M or from another procedure. So let's say that the patient had multiple traumas. So they had to go in, maybe they had to fix a spleen, which is a big surgery, and they also at the same surgery had to put in a chest tube. Those are distinctly different procedures on different body parts. So the spleen would probably be first, and then the second procedure, since it's distinct from the other, completely different purpose, completely different type of procedure, would be a 59 modifier so that it would get paid full like the first procedure. Your 51 modifiers, typically the second procedure gets paid at 50% and then the third at 25% or whatever the payers pay. The 59 modifier flags it that, yeah, we know there's 2 procedures going on here. They're both distinct. We had to do both of them. One was not a part of the other. One was not the same kind of procedure as the other. They were distinct. That 59 is very, very confusing. So don't worry about it if you don't get it now. I just wanted to pull a few of these out in a video. And then this table 8.2 kind of starts pulling them out and grouping them in a different way. So these aren't necessarily new modifiers, they're just grouped a different way with different explanations. So again, here's your 25 modifier. And this table actually does a good job about talking about your global surgeries. So your 54, 55, and 56 all have to do with pre-surgery, during surgery, or after surgery. This will give you some examples of your 59 modifier that we just talked about. Also some CMS, or Centers for Medicare and Medicaid Services, or Medicare. Fairly new HCPCS modifiers. You don't have your HCPCS book yet, so don't get crazy about them. And just kind of walks through with a different explanation and example for each of these. So I did want to bring this to your attention to be able to go through typically, and then you'll have an exercise on them. Typically we have quite a few questions and issues with the modifiers, so I thought I'd just pull a few out and make sure that you guys are understanding to really use this table. Okay, now we'll go on into E&M.